my name is Crystal Walker, and thank you for watching my presentation. My presentation is on preventative ACL injury. It's a preventative ACL injury program for athletes who participate in low extremity sports. So that being gymnastics, my specialty, basketball, soccer, volleyball, any lower high demand sports that could potentially have ACL injuries in them. So here's my presentation. Introduction: this program is a preventative ACL injury program. Like I said, for gymnasts, basketball players, football players, soccer players, and volleyball players. Coaches, this is also for coaches who instruct those sports that are listed above, and any healthcare providers or professionals that need this information. It could be helpful for them. Background: one of the most common knee injuries is a tear or sprain to the anterior cruciate ligament, that is your ACL. Athletes who participate in lower extremity sports in a high demand are more likely to injure their ACL. If an ACL is torn, the most common treatment is surgery, and it's depending on the severity of the injury and the activity level. So if you do tear your ACL, you're most likely going to have knee surgery because they have to repair the ligament. So there are three bones to join to form the knee joint: the femur, the tibia, and the patella. There are four ligaments in the knee: the collateral ligaments found on the side of the knee, your medial, so your medial one's right here, and then your lateral side of the knee is here. Your cruciate ligaments found on the anterior side of your knee and your posterior side of your knee. They cross and make an X form like this, and here is the picture of that. So just a few brief statistics of ACLs. So injuries: estimated that 35,000 reconstructions are performed annually in the U.S. That is huge. Despite surgical repairs, roughly 79% of those individuals develop osteoarthritis. So that just means with the ACL reconstruction or with ACL surgery, athletes who go back to their sports still go through a ton of pain even after the surgery. And then 20% suffer re-injury within 2 years. I know I had tons of teammates who had ACL surgeries year after year after year after year, all 4 years, on the same person. So it's a recurring event. Signs and symptoms. So if you tear your ACL ligament, you will have pain and swelling, loss of full range of motion, tenderness along the joint line, discomfort while walking. Typically, you will not hear a popping sound. You just feel like your knee, there's no stability, and it feels loose. Why I have this program? I specifically made this program to have prehab exercises and rehab exercises. So my prehab exercises are exercises that can be done obviously to prevent ACL surgeries, basically strengthen the knee, strengthen the muscles around the knee. And the rehab exercises are obviously if you did tear ACL, these are exercises that you can do as well in addition to. This program is to help prevent ACL tear and sprains from occurring and from them reoccurring, obviously. This is my presentation. That's that slide, and that's my bibliography. So, with that being said, I am going to be my own subject that does the individual activities. So, for basically to prevent ACL injuries, the best way is to strengthen the muscles in the patella around your knee. So the first thing that I have is just a straight leg raise. So all I'm going to do here is I'm just going to lay down and just do a straight leg raise. So I'm going to be on my back, arms here, or down straight beside you, and literally just going up and down. And what I'm doing is I'm not tapping it on the floor. I'm just keeping it up and down. Literally 2 reps of 10 is just fine, and then you switch and go to the other side. You want to keep it evenly, and you want to do the same amount of reps on each side. So yes. Now it's prone. I have prone straight leg raises. So prone position is on your stomach, and basically kind of what I was just doing. My hands are going to be on my head. I'm going to land straight down, and I'm just going to go up and down. And again, I'm not pounding my knee down. I'm trying to keep a nice straight leg, nice control up and down. 2 sets of 10 on each side. Just to strengthen and stabilize all around your kneecap joint. The next thing that I have on my list are my lovely wall sits. So all I'm gonna do is go down into a almost in a nice squat position, and I'm literally gonna put my hands right in front and just hold it. I will hold it for like 30 seconds. I'm not gonna hold it for 30 seconds right now because I can't, but you just wanna hold it here, nice stabilized, the knee is here. You wanna try to get that 90-degree angle. And so you're just right here. You wanna make sure that your knees are not bending in or going too far out. They're pushed right along that line right here. Right? Nice calf raise. So, kind of dark. Basically, all you're gonna do is go up and down, up and down. Showing a calf raise. Nice. 2 sets of 10. I also have step ups. So while you're at home, while you're in your house, I do not have a box where I can step up on. So I just like to have my stair in front of me and then just step up and down. Up and down. And you can do 2 steps how I'm doing, or you can change it to 1 step, whatever works for you, whatever works for the athlete. Up, down. You're trying not to push off the back leg, but more so push more on the quads and hamstrings here. So pushing off here and down, pushing up and down, and switch. 2 sets of 10 is my golden number. And then side, and just a good old side leg raises. So you want to keep your leg straight. I like to keep your my foot flexed when I'm doing exercises. Obviously in gymnastics, I like to keep the point. Right now, heel flex, and just lift up the leg and back down. Leg. Sound good? All right, so those were my exercises for strengthening the muscles around my patella. Basically, now I just have some exercises to stabilize the knee. So stabilize the knee, meaning just trying to keep it where it needs to be and it not loose. Because when things are loose, then things tend to tear, all right? So the side, I have a normal plank forward and side. Planks are literally, I think, the best exercise you can do for any type of sport. So I'm gonna go down and do just a nice, I'll go this way, just a nice forward plank, hips down, nice hollow body. And again, we're just focusing on our knees, making sure those are stable, don't have them bent. So that your hips up in the air, you want a nice and flat surface. And this can be done 2 sets of 30 seconds. Nothing major, everything nice, smooth, and easy. The next thing is a single leg bridge. I like this one a lot. So you lay down on your back, and first you go up into your bridge. So this is your bridge position right here. Once you are here, you're gonna lift up one leg, and the one that you're stabilizing is actually your left knee, not your right knee. Because this is the one that's taking all the weight on it. As you can see, I'm almost shaking. And then you can switch and keep it there. You can obviously go back and forth, or you can keep it here, 2 sets of 3 seconds. All right. The next thing I'm gonna do is a lunge with a twist. I think this is a good stabilize for the knee because you are in your lunge position and you're putting some rotation to it at the same time. So basically, stepping forward, down here, and then just a nice twist and come back. Step down, twist, and come back. Big step here, down. Again, 2 sets of 10 is just fine. All right, and the last exercise, almost done. Weighted, just a weighted step up. So basically the one that we did earlier, but just add a nice little 3-pounder or a 5-pounder. So you go over here, arm up, or here into your chest. Right here, step up, and up. Up, and like I said, 2 sets of 10 is my magical number, but you can do more, you can do less. And that's pretty much it. Once again, these are all exercises that you can do in home. It's accessible to anyone. You don't really need that many weights. It's just some prehab and rehab, just in case we get an ACL tear injury. So hopefully this can help prevent them. Thank you so much.